Good afternoon. My name is Dr. Eric Cohen. I'm an interventional cardiologist at Eastern New Mexico Medical Center. Interventional cardiology is the branch of cardiology wherein people like me use minimally invasive techniques to repair damaged arteries, damaged heart valves, damaged veins, and things of that sort. What I want to talk to you about today is preventing the need for such intervention. So how would we go about that? Well, the first thing to recognize is that arteriosclerosis, this accumulation of abnormal material, is the most common reason for death and disability in first world countries. Those include obviously America, the European nations, and so forth. So all of us living in these countries are essentially at risk for this illness later in our lives. We've learned that diet, lack of exercise, obesity, simple lifestyle issues that begin early in life and evolve throughout life play a major role in the development of arteriosclerosis. So I would encourage everyone listening to this brief lecture, think about how they live, how they eat, do they exercise, what do they weigh, and pay attention to modifying those things. Finally, in addition, I would ask people to think about several associated parts of their lifestyles that have major impacts. Probably anyone listening now knows that cigarette smoking is not good for anyone. Ongoing cigarette smoking, particularly started earlier in life, is associated with a 200-fold risk increase of heart and vascular disease later in life. Simply either never smoking or to stop smoking as soon as possible can be absolutely life-saving. In addition, alcohol plays a role in later in life cardiovascular disease. We're not as sure why as we are about cigarette smoking, but there's a clear-cut association between significant alcohol use, abnormal glucose metabolism, i.e. diabetes, abnormal lipid metabolism, i.e. problems with cholesterol and so forth, and with heart muscle disease and cardiovascular atherosclerosis. So if one is going to drink, we would strongly encourage drinking in moderation and would encourage a conversation with your primary care providers of what role that might be playing in your overall health picture. So think about your lifestyle, think about your life choices, talk to your primary care providers about screening for hypertension, kidney disease, lipid disorders, diabetes, and make sure that they're treated appropriately. I'm Dr. Eric Cohen. I practice interventional cardiology and vascular medicine.